Okay, we're continuing with this book here, Prevent and Reverse Atrial Fibrillation in CHF, AFib and CHF by me, Pete Rogers. We're on page 26, figure 2.2. We're talking about leaky gut. So here is a drawing of the intestinal lining, the gut wall. This is normal on this side, abnormal over here. The gut wall lining is only one cell thick. The intestinal tract is called the enteric tract, so these cells are called enterocytes. Site means cell. The TJs stand for tight junctions. That's super important. Tight junctions are holding the individual cells together so that nothing bad can get across those tight junctions. And what maintains the tight junctions is when you eat dietary fiber. The dietary fiber is taken up by the good gut bacteria. They've got a smiley face on them to show you that those are good gut bacteria. And they'll convert the fiber into short-chain fatty acids. The most important one is 4-carbon butyrate. It's like a 4-carbon carboxylic acid, a butanoic acid, for example. So butyrate is used by the gut lining cells to make the tight junctions. You need to know that. Butyrate is used to make tight junctions. Enough butyrate is made that it goes into the blood and it travels up to the brain. And up in the brain, the butyrate is used to maintain the blood-brain barrier. So you have to get your dietary fiber if you want to have a good gut wall and you want to have a good blood-brain barrier. So it's essential. We're made to eat a significant amount of dietary fiber. In addition, some of the dietary fiber is converted to acetate, 2 carbons, and propionate, 3 carbon fats that go straight to the liver through the portal vein. And that's one of the reasons why you don't need to eat hardly any fat. You can get by with eating 1% or less of fat because you're getting all this extra fat in this way. And it's a good way because it gets down into the colon before this processing occurs. So there's no risk of leaky gut. When you eat a high-fat diet, that increases the risk of leaky gut in and of itself. The excessive amounts of fat can function like detergents because they're amphiphilic, meaning they're both polar and unpolar, and they can cause problems with the gut lining. Okay, this column of things here over this black arrow are all things that increase the risk of leaky gut. So antibiotics, dietary oils, excessive saturated fat, which means meat and dairy, glyphosates, the stuff sprayed on non-organic foods, about 70 different types of food, more than just soy, other herbicides, alcohol, emulsifiers in processed food. I just tell you this because all of these things are contributing to increasing your risk of leaky gut and subsequent AFib, autoimmune disease, and blood clotting. Okay, carrageenan, the BT corn, non-organic GMO corn, high fructose corn syrup, the soap like from the dishwasher. If you don't use oils, you don't even need a dishwasher. I never use a dishwasher for decades. Okay, BPA, birth control pills make it a little worse, artificial sweeteners, the Al and the F- that are in tap water, Al as in aluminum, F as in fluoride, F-. If you had radiation therapy, the gut, traumatic brain injury will also cause some increased intestinal permeability, leaky gut, or a stroke. Anything that worsens the blood-brain barrier will tend to worsen the gut barrier. Corticosteroids will decrease it. Excessive psychological stress, you'll vasoconstrict your splanchnic circulation, which means your blood flow to your gut. Caffeine contributes to that. Sleep deprivation contributes to that. Okay. So anyways, what happens? When you have leaky gut, you have a lack of these tight junctions, and the bacterial endotoxins like LPS, that means lipopolysaccharide, that comes from bad bacteria, from gram-negative bacteria, that can get across the gut wall and start causing problems. You can also get across the gut wall the gram-positive bacterial endotoxin, LTA, lipoteichoic acid. Okay, and then those are going to cause increased risk of forming blood clots. They're usually very small microclots, but they can still plug up small arteries, arterioles. So a typical one's about 2 to 200 microns, and normally fibrinogen, the blood clotting protein, is like an alpha helix. It's like a slinky. It's secondary protein structure, but then it'll change the beta pleated sheet, which is flat like a deck of playing cards. So it goes from being like a slinky, cylindrical, to being flat like beta pleated sheet, deck of playing cards, and then they'll start sticking to each other, forming a single giant molecule. So that's called polymerization, and precipitation in blood means to clot. So you start forming all these clots from your fibrinogen being activated in this way by the bacterial endotoxins LPS and LTA. Also, if you have abnormal high amounts of free iron, which most men start getting that after their mid-20s, women start getting that after 55 years of age or so, assuming they went postmenopausal at about age 50. That makes the blood more prothrombotic. So you don't want to be iron overloaded. I specifically, when I get blood for a blood test, I'll have them pull off a couple extra tubes and discard it because I don't want, I want to keep my serum ferritin low. I want to keep my free iron real low. Okay, so anyways, these clots are also refractory to lysis, meaning that they're more difficult to dissolve. Because normally we always have a little bit of blood aggregating, disaggregating, clots being dissolved by clot dissolver that's in the blood intrinsically. There's a certain amount of that. But when these things form, they're harder to dissolve, so they're more likely to plug up a small artery, including in the heart. And you plug up these small little arteries in the heart, you make more heart muscle ischemic, meaning lacking oxygen delivery, and it can then contribute to cardiac dysfunction and atrial fibrillation. Okay, so that's why this is bad. So what's the answer? Eat plant foods. So you get the fiber and you avoid the fat. That's what you want. So amyloid clots are also called fibrinolytic clots. The people who've done the most writing on this are Douglas Kell from England, PhD guy, and Etheresia Pretoris. She's a PhD lady from South Africa. They're both very smart. They actually deserve a Nobel Prize, but they'll probably never get it because they don't want the pros knowing about this. Excessive free iron, we talked about that. Women don't get it until they're postmenopausal because they're menstruating. They lower their iron levels in that way. This is a good example of a disease where you can have cardiac angina, but a normal cardiac cath, because the epicardial coronaries are open, the big arteries, but the little arteries can be plugged up by these clots. You can sometimes get this called ANOCA, angina, non-obstructed coronary arteries, clean cath. Okay. So anyways, these are the epicardial, the big ones on the outer surface of the heart. That's the one you've heard of before. You will have heard of, if you know anything about coronary artery disease, these epicardial coronaries. The left main, they call that the widowmaker. They tend to exaggerate the lesions in there. The circumflex, going around the left side of the heart, left circumflex, LAD, left anterior descending. And there's also a right coronary artery, RCA. So anyways, these are the intramuscular branches going into the parenchyma of the heart, into the cardiac muscle. So anyways, we'll leave it there for today. Hope you found that helpful.